our presenter po, she's an Australian national who has been living in the Philippines for more than 2 decades. She is an honorary Filipina. I suspect she's more Filipina than many Filipinos. She has
pretty much like Peter Wallace.
Opo, yes. Opo, ayun. And she cares very much about the country, which is why she has volunteered to analyze data relating to the effects of vaccination on our population. She has a medical science degree, so she has training as a physiologist in medical science, but she's been working as an engineering manager and consultant, and she really loves data analysis po. She's doing all of this on her spare time, and we would like her to present personally the results of her analysis.
Sige, thank you very much, please. Yeah.
Thank you.
Hi. Hello, thank you. Am I sharing screen already, Ellie?
Not yet. Just go ahead and share your co-host.
Okay, I'm just gonna.
Yeah, just like what we did in rehearsal.
Yes. I just have to find the right screen. Here we go. Share screen options. There we go. I can't see it. Hang on. My screen is not big enough. Okay, share screen. Here we go. Okay.
Yeah, can you explain why she remains anonymous, ma'am? You will remain anonymous?
Only because I don't want attention, because I'm an expat here. But I'm very prepared to share all of the information that I have prepared. So I want to start with a prayer because I believe the information I'm sharing is of the utmost importance. So I'm saying, God, please guide us, your humble people in this endeavor. Grant us your strength, your wisdom, and the strength and tenacity. Open the ears and minds of our leaders. Open the eyes, hearts, and minds of our citizens. I'm your servant and your vessel. Now, what I would like to say, Senator, if you would like to ask questions, please do, no problem. I would like to say before I start, the key thing we need to remember is that any public health measures should not be worse than doing nothing, okay? So what I have tried to do is to review the data that is available in the Philippines now and to set out a logical case on whether or not the current public health measures are working. Okay, I'm trying to see how to get my slides to move. Okay.
There should be.
I can't do page down.
There arrows.
Oh, there we go.
There.
So, okay. So what I have done is I've done a review of the Philippines population data on registered births and deaths. And the reason I have done this is because it is concrete information. Okay, why am I referring to population data? Bearing some catastrophic event, population death rates are typically stable over time. Population data, including all-cause mortality, is a very good reflection of population health. And population birth rates also follow very predictable patterns and are very stable over time. So we only see changes in population births and deaths with major population movements, demographics. We can see it with economic situation changes or some catastrophe. So this is why I'm referring to concrete data published by the Philippine Statistics Authority. Okay, so you ask, how stable is population death data? I have presented here 10 years of death data. And when we look at this data, you can see that our death changes only range from minus 0.5% to 5% on a year-by-year basis. Please keep this in mind as we go through the presentation. We don't expect to see any major changes in population death within a short time. Okay, stability of birth data. This is also from the Philippine Statistics Authority. And we look at birth data from 2010 to 2019, and our year-on-year changes range from minus 0.2% to 2.5%. This is very stable. I'm presenting this because you need to understand this as a background to the information I'm going to present. Okay, the impacts of lockdown on population. We will expect impacts. So our lockdowns here started on the 16th of March, and the lockdowns have continued up until now. We also know that poverty will increase due to lockdowns and will decrease life expectancy and increase death rates, short and long term. We also know that a lower income and increased poverty gives us less access to medical care, which may mean higher deaths, also less quality food, and people may defer having children. So we could expect our birth rates to go down. Our birth rates may also be affected by less movement of people because we don't have OFWs coming home and becoming pregnant during their holidays. And because we have had no face-to-face school or higher education for the last 2 years, we would expect lower rates of teenage and unmarried pregnancy. However, for the pregnancies, remember we have a 9 to 10 months delay before you would see any implications, because the pregnancies that occurred prior to lockdown will still proceed. Okay, so sources of my data. All of this data is taken directly from the Philippine Statistics Authority. This is their data drop dated 29th of November 2021. And I've also referred to the Department of Health COVID bulletins for data about COVID death rates, COVID incidents, vaccination. So I cannot question if this data is completely accurate or not, but what I will present, you will see the trends on what is happening. So I've compared 2019, 2020, and 2021 data. The reason I look at 2019 is 2019 was the last normal year, and we should see normal patterns of births and deaths in that year. So after we had lockdown on 2020, our data should show the impacts of lockdown. And then bear in mind also on the March 2021, we started population vaccination. So population data from March 2021 should reflect the impacts of the mass vaccination program and would also include the impacts of the lockdowns. Okay, so I'll just remind you, we had several priorities for the rollout of vaccines. The initial vaccine rollout was priority A, which is health workers, frontline workers, and senior citizens and people with comorbidities. Then in the third quarter of 2021, middle of the year, we started with teachers and the eligible B group. And then by the fourth quarter, we moved to the entire population. Again, this will be relevant for the information I'm going to present. Please also note that the vaccine boosters started in November, and this is not reflected in any data yet because we don't have data up to November on population. Okay, so here it's 2019, 20, and 21 births. The red line is the 2021 births up to September, and 2019 is blue. So you can see that we have a big drop in births. We have a 9.2% drop in births between 2019 and 2020. This is far more than the 5% I mentioned as a maximum. And then from 2020 to 2021, we have an additional 20% drop in births. Okay, so between 2020, in 2020, we had 145,000 fewer births than in 2019. And in 2021, up until September only, we have 320,000 fewer births. So we have a catastrophic drop in the number of babies born. If you want to look at the daily births, 2019 were 4,500, 2020 daily births, 4,200, and now in 2021, our daily average births are only 3,300. So we have lost about 1,200 babies per day as a result of the COVID lockdowns and possibly the vaccinations. Okay, so next. Then I looked at deaths. I compared the deaths in 2019, 20, and 21. In 2019, our last normal year, our daily deaths were averaged at 1,700 a day. Okay. In 2020, we had no excess deaths. In fact, we had a drop in deaths. This is the line showing our deaths in 2019. So we didn't have any excess people die. In 2021, however, we have a very large excess of deaths. Now we have 2,300 people a day. This is an extra nearly 700 people per day have died up to September. Okay, this up to September is equivalent to 188,000 excess deaths that we wouldn't otherwise have had. Okay, so this is quite astounding data. And this is based on the entire population of the Philippines. And we'll notice that the very big jump in deaths comes in July.
Excuse me.
Which is when...
Can you give us the breakdown of the 3,444?
The three, what do you mean the breakdown, sir?
The breakdown of the deaths, the causes of the deaths.
I don't have the causes of death here, sir. At this point, I don't have the causes of deaths because that data is not yet available. But what I'm going to present to you is that there is a very big change in deaths and it started at specific times.
All right.
Okay,
Thank you.
so there's still a lot of data that's not yet available because the 2021 data is still being compiled by the Statistics Authority. And also as the public domain information may be different from what they have available internally. And so I hope you will be able to compel a much deeper investigation of this information. Okay, so this was population data, and this data is averaged. I'd also like to show you for 2021, I compared the daily deaths and the daily births. Our daily deaths have risen from the beginning of January up to August, and our daily births have also dropped. And as of September 2021, we are already having more deaths than births. So this is a effective depopulation point. And if this continues, our country's population will drop. Okay, so again, this is the entire Philippines population. It's based on registered deaths and registered births. And the data as of September, we may still see additional deaths registered due to late registrations. So the situation may become worse in the final data.
Speaker.
Okay. Sir. Okay. So I have here the caveats. All of the data I've taken is at face value directly from publicly available information. I've also considered now that the Philippines whole population evaluation is too broad to look at because the effects will be average, blunting any specific effects. I also remind you that pregnancy takes 14 weeks, so any impacts on registered live births will be delayed by 9 to 10 months. I'm also going to show you that there were no excess deaths in 2020, the first year of lockdown. I've showed you that already. And I will also show you that there was minimal difference in deaths in January and February of 2021. This is highly significant because the vaccine rollout started in March. Okay, so increases in deaths and the sudden increases that we observed cannot be attributed to lockdowns. They have to be due to the intervention because they're very sudden. Okay, the data is still preliminary. It may be revised, but it will probably make the data look worse, not better. Okay, and the data for 2021 is only available up to September, which is the last relatively complete monthly data set available. Also note that booster dose delivery started in November, and we have no data yet available to assess any implications of this. Okay, I would also like to bring up that vaccination of pregnant women started in early August of 2021, and they started vaccination of women mostly in their third trimester. So this would have impact on pregnancies starting August, September, October, November. So if there were an impact from vaccinating pregnant women, we should start to see that in the last available data set, and it should become more apparent as we have more data available. Okay, so I then did a breakdown of assessment of birth and death data in 6 NCR cities. I looked at District 1 and District 2. I looked at the excess registered deaths from 2020 to 21. The reason I took this data is because I had complete data available, even though we know that the 2020 data could have been slightly less deaths than usual. So the excess deaths that I see in these 6 cities range from 12 to 35% above normal. And all of the cities show similar patterns, which this is far greater than the 5% maximum historical variation. I also see a reduction in registered births ranging from -20% to -34%. This is also far greater than our historical 2.5 maximum variation. San Juan showed depopulation. They already have less births than deaths. And the reduction in births started in 2020 and got much worse in 2021, worse in September. Increase in deaths across all cities started in March, and there is no explanation for this. There is no natural explanation. So I will show you the data. Okay, this is District 1, this is Manila. If you look at January, February data for deaths is below the 2020 data. However, by March and April, we have a 61% increase in normal deaths. This then dropped off and started rising again when we have the rollout to the C category people. We have an increase in deaths. So we have very big spikes in deaths, and we also have an overall excess of deaths of plus 12% if we are looking just up to September. Registered births in Manila, we also see much lower than we saw in 2020. So we have a minus 27% decrease in births. Okay, this is now the second district. This is Marikina. We have normal, completely typical deaths, January and February. In March, we have an increase, and in April, we get up to 97% excess deaths. And this then drops off and increases again after mid-year. So we have a 32% excess deaths up to September. In the births, we also see a big drop in births, and we have minus 27%. So what I'm presenting to you is massive changes in population, which are unprecedented. So I'll show you, this is the same in the other cities. Yes?
May I ask, is that connected with vaccine rollouts also and the inoculations, the spikes?
Sir, what happened in March? We only started the vaccine rollout in March. Our deaths have only these are excess deaths. These are not normal deaths. These are excess deaths have only started spiking in March onwards. So, sir, you can draw your conclusions. Okay, so this is Mandaluyong. Okay, same thing. We have excess January, February deaths, completely normal. March, April, look at our spike, plus 91%. This is when you roll out to the healthcare workers and to the vulnerable population. When you vaccinate a vulnerable population with a product that is perhaps has issues, you will expect a much higher than typical death rate. So I expect that what you are seeing here is the vaccines have had a big impact on the longevity of the vulnerable population who were involved in that intervention. So overall, Mandaluyong, plus 32% up until September. Our birth rates are also much reduced. Okay, Marikina, same thing. Starting January, February, normal deaths. March, April, spike, and then we start spiking again, second half of the year. Okay, same thing. Now this is Pasig. This actually is 117% increase. Okay, so this is you times by 217% of the normal death rate to get this. So we have a massive spike in deaths in the city of Pasig, starting in March and April. It dropped off June, July, and as we start intervening the entire population, we start spiking again. Okay, I think this data speaks for itself. Quezon City, same thing. see spike in March and April, correlating with a certain intervention, and we have birth rates dropping off. So, and then this is also San Juan. Okay, San Juan, we have a big spike. We also have a depopulation with our deaths at 878 being higher than their births. So we have depopulation in San Juan. Okay, so we could ask, is this the same in the provinces? So I've also had a look at the selected provincial centres, and I looked at a number of these just so we could have a snapshot to see if we see the same patterns. And we do. We see the same patterns of sudden, unnatural increase in deaths. I also looked at Lanao del Sur because I was passed some information that this city has low vaccination rates, and they present a different pattern of deaths compared to the other cities. We also see decreases in births, okay? And in the provincial centres, we see a big drop in registered live births in September. I don't know if that is because of delayed registration or whether this was a result of vaccinating pregnant women. So let's have a look. This is Cebu. Cebu, we have a long delay with relatively normal deaths, and suddenly in June, we have a massive spike in deaths. Now, I understand the mayor of Cebu was also fairly reluctant to vaccinate her population, so it would be revealing to identify when their vaccination rolled out. And in Cebu, we can see our births were slightly lower, but we started to have a big drop in births from August to September. So this represents a highly unusual pattern. Negros Occidental, same thing. We start March, slowly March, April. So if these cities are able to correlate when their vaccine rollout started, I don't have this data, so I could not do that yet. You may be able to see that the rise in deaths happened in the months after the vaccines started. Okay, this is Iloilo. Iloilo also had a slow rollout, and then we have a massive increase in deaths in August, September. Okay, and their birth rates continue to be lower. Okay, this is Davao, same thing. Davao, we have excess deaths actually all year, but with a big increase, overall 43% increase, and decrease in births of minus 19%. So I'm presenting that this is quite catastrophic data. So I was sent this, Lanao del Sur, this was yesterday's newspaper. Lanao del Sur is saying they need government help because they only have 16% of their population vaccinated. So let's have a look at what Lanao del Sur looks like. This is a small city. So their death rates were higher than usual. We see a spike in March, which could correlate potentially to healthcare workers being vaccinated, followed by a drop. And here maybe delays in registration. But this city, they were saying this city have a lot of vaccine hesitancy. Perhaps their citizens saw something happen in March, which has increased their hesitancy as the year went on. I can't draw any conclusions. This is just data, which needs to be looked at further. Okay, so summary of my findings here. We see sudden increases in mortality in all of the regions reviewed. These are far above historical year-on-year changes of 5%. We have registered birth decreases are also far above the historical changes of 2.5%. And the start of the excess deaths and drop in births varies by regions. So we want to ask if the big drops in birth registration in September are a result of delayed birth registration or from vaccination of third trimester pregnant women. The November data should be revealing. And there appears to be no possible natural explanation for these patterns. So it has to be due, at least in part, to the intervention. So could the intervention be implicated in excess deaths? I then looked at excess 2021 deaths against 2019 deaths, which were the last year of normal deaths, by month and by the number of vaccines dosed. I also looked at the cumulative excess deaths in 2021 versus the 2019 against the cumulative number of vaccines of all brands. The initial doses vaccines in the Philippines in March were Sinovac and AstraZeneca, and all of the other internationally available emergency use products became available within the year. Okay, so we have everything. We can't specifically target any vaccine. So here is my prediction. I'm predicting that excess registered deaths in 2021 could be well in excess of 400,000 if the current patterns continue. And this is based just on dose 1 and 2 of vaccine. So it was mentioned earlier that we have reports of 1,200 deaths related to vaccines. Well, it's quite possible that we have unexplained deaths for several 100,000 deaths. Okay, you also have to remember that this evaluation only covers a 7-month period from when the vaccination started. And we would expect that the deaths may escalate over time if long-term consequences start accruing. Okay, so I did an evaluation. This is a little bit complicated, but what I did is I looked at I tried to correlate the number of vaccines given with the excess deaths. And in the beginning of the year, the data was not stable, but by July, August, and September, I came up with an increase in excess deaths of 0.41% per dose of vaccine. So what this means effectively is that for every 250 doses of vaccine, one person will die. We cannot say that is the cause, but when we look at the population data, one person dies in excess for every 250 vaccines given. So this is how I plotted this. Okay, the blue is total deaths per month. This is normal deaths. Okay, I plotted the COVID deaths so you could see the contribution of COVID deaths against the total monthly deaths. I've also plotted excess deaths so you could see how much of the deaths were excess. So you could see in January we have a negative excess deaths and we have small COVID deaths here. It's I have to check the data. Anyway, February, March, we start to see an increase in COVID deaths. We also see an increase in excess deaths, which escalates through the year. Okay, and we also see overall deaths increase. This is because our normal death rate is relatively steady, but the increase in height of this bar is due to the increase in excess deaths. Now, what I have identified is that for every 1,000 vaccines, we will have about 4 people die. Okay, but if we look at the infection fatality rate for COVID, we will have approximately 1.5 person die for every 1,000 cases. So the number of deaths from the vaccines based on this evaluation are more than double the number of deaths that would occur from COVID. And you also need to understand that not everyone will get COVID, but if everyone is vaccinated, everyone is subject to that risk. So this was based on 1 death per 250 doses of vaccine. If you get 2 doses of vaccine, the chance of dying becomes 1 in 125. Okay, more data. So this is how I plotted. This is just the total vaccine doses per month against the total vaccine doses per month against the excess deaths per month. Okay, you can see it follows a fairly similar pattern, but not exactly. However, this is when I looked at the cumulative deaths per cumulative dose of vaccine. And this is what I say, 1 excess death per 250 doses of vaccines. This is the vaccine doses in orange, and this is the deaths, excess deaths in blue. There seems to be a very concerning relationship between these 2 lines. Okay, so I then predicted, if we know that this is our existing deaths, this is our excess deaths, if we know that, and I know the doses of vaccines that were given, I can now predict, based on the number of vaccines that were injected in October, November, and December, what my total deaths will be and what my excess deaths will be. So I am predicting that by the end of the year, we will have somewhere around 450,000 excess deaths.
Wow.
Okay. And if we look at the COVID contribution to the excess deaths, it's only 9.35%, which means that 91% of the excess deaths are not attributed to COVID, even if we assume that all of the excess deaths were due to, if we assume that any COVID deaths are counted as excess deaths, they're not counted as normal deaths. So we're seeing a massive increase in excess deaths compared to COVID deaths. Okay, and again, this is the preliminary data, 0.0041 excess deaths per dose of vaccine, 4 per thousand, sorry. So this is a table that I was provided, and this is the principle I mentioned at the beginning. The outcome from any health intervention must not be worse than doing nothing at all. And then we look at the infection fatality rate. This is the infection fatality rate for COVID. And we can see that for most of the population, the infection fatality rate for COVID is low. And it's lower than the 0.41%, which I have identified as the death rate from the vaccines. It is only for people above 60 years of age that their risk of dying from COVID becomes greater than their risk of dying from the vaccine. Okay, so I will just present, this data speaks for itself. From this data, we have a crisis which is rapidly escalating, and it will get far worse before it gets better, even if we could immediately stop. And remember, we're already the middle of January. We don't have complete data for October, November, December. We're missing 3 months data. And we can also recall that we had a massive vaccine drive in early December. That will have very big health consequences. The current crisis only reflects the short-term consequences of the lockdowns and the intervention. So if the Philippines has entered a depopulation phase, apparent from last September's data, remember comparison of births and deaths, and it's getting worse, this will be the worst crisis ever in our history. And we have a depopulation event in full swing. I would also present that the focus on our major regional cities, such as NCR, means that we have vaccinated most of our professionals, most of our business people. And if the situation gets worse, we may lose a lot of our business leaders in the future. And now I make an appeal. And Senator, I'm so glad you're here. So any senator, councillor, mayor, barangay captain, church, or community leader who sees this data, I'm pleading with you to act now on the side of caution, because we need to address these sequelae. You cannot say you have not seen this data. Once you've seen this, we must pause, because if we don't, the consequences are going to be unbearable. And this is an article written by Business World, which also discussed. So I can hand over to Attorney Tanya. I'm sure there will be many questions. Senator, I can give you all of my information, and I'm happy to answer any questions.
Senator Soto.
Thank you, Francis. I think there were a number of participants raising their hands, so I will give way first before I have no further questions. I would only want a copy of the presentation, if possible, and I think the group has my email address, and we will greatly appreciate a copy of the presentation that was given us. It is informative, enlightening, but alarming at the same time. So go ahead, Francis.
Yeah,